Sadhana Tandon calls her pet dog Pepper her lifeline. She says the pup keeps her on her toes all day, something which she says was not possible just a couple of months ago. 63-year-old Sadhana was infected with the coronavirus during the second wave. While her initial infection was not severe, a few days after testing negative, she was diagnosed with cardiac inflammation, a post-COVID complication which left her with a crippling weakness for months.
I used to feel so weak that I would, at times used to feel like I can't even sit, I must lie down. I hardly had any stamina. I was, though, a very active person earlier. And I started feeling depressed also. I used to feel very low.
Sadhana's case is not exceptional. Many other people have suffered from post-COVID complaints, more commonly known as long COVID, a name given to the persistent illness a person feels while facing symptoms or effects for weeks or months after testing negative for the coronavirus. Dr. Ayush Gupta says patients have come to him with complications like headache, fatigue, depression, palpitations, and cardiac issues, among others.
A staggering number, that is 60 to 70% of patients who recover from COVID have these effects on them. There are some kind of risk factors which predict long COVID. Duration of illness is one. Severity of illness is second. It is not completely understood. It is a science in evolution. So even young patients may be experiencing more symptoms than an elderly high-risk patient.
30-year-old Roshni Divakar was an avid yoga practitioner. She says she was at her healthiest stage when she tested positive during the second wave, and her infection was quite mild. But soon after, she started experiencing complications and was diagnosed with a balance disorder called vestibular disorder, which makes her feel dizzy and causes constant ringing in her ears.
It's like being on a boat all the time. So when I stand, the floor is like this. So for me to walk straight is a struggle. There was a point where I literally needed to be lifted to go anywhere because I just couldn't get my balance. It can be very overwhelming and exhausting.
While for Roshni, it has been rehabilitative therapy and yoga that have helped her gain a sense of control over her condition. For Sadhana, it's been medication, ample rest, and her pup Pepper, which helped her with her post-COVID complication.
He sleeps with me, he eats with me, like a small child. I have a grandchild home now.
Sadhana says she is a lot better now as she has found some happy distraction with Pepper. But for many like her, the lingering effect of COVID remains inexplicable.